Good morning, everyone. My name is Tracy Wodach. I'm President and CEO of the Connecticut Association for Healthcare at Home. Our membership includes skilled home health care providers, as well as non-medical home health care agencies who provide services to nearly 20,000 Connecticut state-funded or Medicaid residents annually. We stand here today because home health and home care are in crisis. We are united in our urgent message to the state. We need more funding. We have been facing severe workforce shortages and Medicaid funding shortages for years, but this shortage has now risen to crisis levels, exacerbated by the pandemic and now the ramped up minimum wage requirements. We are not able to compete with other providers that offer far better salary and benefits. The most recently approved biennial budget sent a strong negative message to our industry that we are not a priority, even though we have been able to save the state $2.5 billion in just over a decade. And this past fiscal year 2019, we saved $508.4 million alone. The result? Many of our providers have decided to greatly reduce or stop state-funded services altogether. Yet, we know that that's not in the best interest of those we serve. So, on Tuesday, June 29th, the Connecticut Association for Healthcare at Home submitted their specific recommendations to the state for distribution of federal stimulus dollars available through the American Rescue Plan. This is our last resort. This urgent request is for stimulus payments to our providers for wage and benefit enhancements, workforce development, recruitment, and retention bonuses. Here's the reality. Our home health care agencies who provide highly skilled medical services in the community have only received a 1% increase in Medicaid funding in the last 14 years. These are the very providers who went to people's homes during the pandemic to keep them out of our institutional settings, a time when our costs skyrocketed and the workforce shortages that already existed exponentially bottomed out. We made our strong case to the legislature, yet the budget fell sorely short, failing to support us through additional Medicaid funding while choosing to invest significant dollars in nursing homes and group homes. Additionally, our non-medical home care agencies who successfully support thousands of state-funded elderly and disabled clients in the community face the challenges of ongoing minimum wage increases without receiving the necessary state funding to support these mandated wages. Again, a failure of the system to support the very providers who save the state millions of dollars each year, while also being able to keep people in their homes, the most cost-effective setting and the place they want to be. We have with us today several providers, some of the children that are cared for in home, and also we have some supporting legislators. I'd like to hand the mic over and welcome Representative Holly Cheeseman, who is a ranking member of the Finance Committee. Representative Cheeseman.
Thank you, Tracy. Thank you all for coming here today. Thank you. Thank you to those who are taking care of our most vulnerable children, and yet not getting what you deserve. I wish I could say it's a pleasure to be here today, but in fact, it's shameful. It's shameful that these wonderful people haven't received an increase in what we pay them. It's shameful that we don't value their work enough to restore that 16% cut that they took. It's shameful that an administration that prides itself on looking at return on investment ignores the savings, both in monetary terms, in lives, in value that are provided by these people. Tracy mentioned the $2.5 billion over 14 years and $500 million in the last fiscal year alone. Those are real dollars, but more importantly, these are real lives and real individuals who deserve the kind of recognition that you seem to only get if you belong to a union. People have choices. People make choices to keep their loved ones safe at home. As someone with a 95-year-old dad, I know how much that means. Looking around at these beautiful children, shouldn't they be allowed to stay at home with the care they need? So I am calling on the governor's office to answer this plea, to pay attention to these lives, these precious, darling children. Let them stay where they belong and value the people who are providing their care the way it should be valued. The money is there. We can find it for other things. Let's find it for them. And I encourage everyone to pick up the phone and call the governor and the OPM and anyone else who will listen, because we need action, and we need action today. Thank you.
Thank you, Representative Cheeseman. I'd like to now ask Representative Cara Damato to come to this podium.
Thank you very much. My name is Cara Damato, and I represent Bristol, Connecticut. And Bristol is home to one of the largest home care providers in Connecticut, MR Home Care. And some of the individuals that they provide services for are seniors. And I'm here today to lend my support to everybody here, to thank the association for championing this issue, and to demand that our legislators and our governor provide funding and increase reimbursements for these agencies. Due to increased costs in the state of Connecticut, unemployment, minimum wage, and other costs, our seniors and our disabled are facing cuts in services. And we cannot stand for this. I am so thankful for everybody who's here today, but we need to stand together, stand up, and demand that these reimbursements increase. So I just want to thank everybody again for their support, and I look forward to working further and getting that increase. Thank you.
Thank you, Representative Damato. There were several other legislators that have lent their support throughout this advocacy journey, difficult journey. I'd like to thank, they couldn't be here today, I'd like to thank Senator Anwar, Representative Steinberg, Representative Pettit, Representative Abercrombie, Representative Gresco, Representative Cook, and Representative Case, all in strong support of our efforts. Senator Austin as well, I apologize. So now I'd like to have you hear from some of our providers and some of those that they care for in the home. Here today to help bring further clarity and support to our plea for funding our three home and community-based providers. Let me begin by introducing Gloria Merritt, who is Vice President of Behavioral Health Clinical Services at Alara Caring.
Good morning. I'm Gloria Merritt. I'm a behavioral health nurse, and as stated, I'm the Vice President of Clinical Services for Behavioral Health with Alara Caring, which is one of the leading industry providers of home care services. In Connecticut, we provide behavioral health services for more than 3,500 behavioral health clients throughout the state through our branches that are located in New Haven, Waterbury, Cromwell, Windsor, Shelton. I think I got it. Our care is directed to those individuals with severe mental illness. Their medical comorbidities are also at risk because of the impairment created within their severe psychiatric illness. Our clients sometimes are substance users, others are combat veterans who are dealing with PTSD. Some of our clients are individuals transitioning from the Department of Corrections hoping that this time they stay in the community and out of jail. All of our clients have other social determinant factors that greatly impact their well-being. Poverty, isolation, lack of family support, and difficulty accessing care. Now, I've been a behavioral health nurse for 47 years, and I've held a lot of roles. None as significant as this one, and never as meaningful as this past year. Our clients during the pandemic were left alone and scared. Now, I understand the need for community resources to regroup and protect the health and safety of their staff. For many, many months, the only humans our clients saw were our home care nurses and aides. And through their services, we found a way to comfort, support, show up, and create some different ways of providing care that allowed them to remain safe in the community. Let me tell you about one of the clients. He was 20 years old when I first met him and initially transitioned into the community for the very first time. He was significantly impaired by his severe mental illness. The only way he was able to stay within the community was through a collaboration of services, ours included. His family trauma and abuse left him without any family support, and his psychiatric illness left him very isolated and guarded around other people. One day during the early pandemic, I showed up and he asked me a very simple question. How am I going to eat? How am I going to get food? For his impairment prevented him from being able and being capable of shopping for himself, cooking for himself, and those services had been provided by ancillary providers. The pandemic came and suddenly they were gone. We did pivot and we accessed other care. We increased our nursing services. We added home health aides to provide the services needed for him to remain in the community. The one piece I didn't say is his lack of food because of that family trauma was a huge trigger for him, and in the past led to his visits to the emergency room and hospitalizations because of the increase in his psychotic symptoms. We managed to keep him out of the hospital, out of the emergency room, and sustained him for many months in the pandemic. What behavioral health home care brings is significant. We provide clinical support and guidance. We collaborate with every treater out there. We provide medication management and oversight and administration if needed. And we navigate our clients to the greater healthcare system so that all of their needs are met. We belong a consideration with the continuum of care when pilot programs are formed and funding is distributed. In 2016, our rates were cut by 15%, and despite our efforts to regain some of that funding to provide the services that are so needed, we were overlooked. We stood alone with our clients during the pandemic. What I hope today is that we are seen, we are heard, and we will not be overlooked. Thank you so much.
Thank you, Gloria. Now I'd like to introduce Coco Selman, founder of Illume and chair of our association's Government Relations Committee. Coco.
Good afternoon. Thank you so much for coming today and listening on behalf of Home Health. I'm Coco Selman, the founder and CEO of Illume Home Care. We specialize in the care of medically fragile children and adults who require around-the-clock nursing care at home. We care for babies and children with tracheostomies, ventilators, and other technology-dependent interventions. For the last 8 months, dozens of medically fragile children have been stuck in the hospital because they require continuous skilled nursing to leave and go home, and there are no nurses available to care for them. This is a failure of the Connecticut healthcare system. How could this happen? In the last 4 years, continuous skilled nursing Medicaid rates were cut by 16%. During the pandemic, dollars flowed into other care settings. No doubt they need those dollars, but home health has been left behind time and time again. Facilities can now pay nurses as much as $10 to $15 per hour more than home health can. Imagine that. You are a single mom nurse. You can't afford to take a $10 an hour pay cut. In the last 14 months, my company, our agency has lost 24% of our clinicians due to pandemic-related challenges, including nurses leaving for higher pay elsewhere. This has directly impacted the care of our current patients, and it has completely stopped our ability to take any new patients home from the hospital. This is why dozens of kids right now are stuck in the hospital. I've been asked, is this really a crisis? I ask you this, if you had a 3-year-old you could not bring home from the hospital for a year, even though they were medically ready to come home, would you consider it a crisis? I can tell you I wouldn't. The governor recently approved 10% Medicaid increases for skilled nursing facilities and group homes. To bring kids home, we need the governor to do at least the same for home health. The cost of in-home nursing is a fraction of the cost of institutional care. We can have an increase to our skilled nursing Medicaid rates. We can hire the nurses we need, bring children home from the hospital, care for them safely at home, and still save the state money. Connecticut home health complex care Medicaid rates are in the dark ages. All Medicaid rates for home health are in the dark ages. Rates in Massachusetts and New Jersey are 20 to 25% higher than they are here in Connecticut. They are 10% higher in Rhode Island. And Pennsylvania is in the process of increasing their rates by $10 per hour. All these other states understand the value of home health investments. I founded Illume 5 years ago, inspired by my stepdaughter, Amelia, who's sitting here next to me. My medically fragile stepdaughter here has received in-home nursing care 16 hours a day since she was 6 years old. My hope was to bring access to more patients and families like her. I'd like to now take a moment and introduce another mother. There are several here, but Rachel Botts, I would like to introduce, along with her beautiful daughter Ella, who receives continuous skilled nursing at home. And if you could just, if you would please tell us about Ella's condition right now, her diagnosis, and how continuous nursing has helped you.
Ariella is 8 years old. She's about to be 9. She's amazing. She has what's called, she is amazing. I know everybody's biased, but I actually have the most amazing. So she's about to be 9. She has what's called Nemelin rod myopathy, and so all of her skeletal muscles are weak, which make breathing really hard. She can walk. She's been known to dance and sing really loud in the shower, but all of those things tucker her out. So she gets very tired very quickly and sometimes too tired to breathe. So she needs someone with her at all times, because we need to make sure that her lungs are clear and that she's breathing and that she's not falling, because once she does fall, it's like a ton of bricks, and a broken bone is just one trip away. Every single year, Ariella has missed more than 30 days of school because she didn't have a nurse to be with her and keep her safe. Ariella was reading when she was 4. She is smart, she is capable, she is vibrant, and she's missing out on what is meant for her because we can't keep nurses in the system to help our children be healthy. And that is a problem from a moral and humanitarian standpoint, but it's also an economic issue. And at the same time that rates are being cut, the LPN programs in our high schools were being pulled out of the VOTEC system, and we lost a massive pipeline of talent coming into the healthcare system in Connecticut. And so now we have a mass amount of CNAs, and we have our very competitive RN program, RNA, that's the vaccine. RN programs, and there's no middle rung of LPNs that satisfy the needs in all of our healthcare facilities and in all of our homes. So this is a problem that we've created ourselves in Connecticut by being penny wise and pound foolish. It's a problem that is going to be lasting for generations to come. Medical advancements are helping our children live longer, stronger, healthier lives. And until we realize that we need to step up our community advancement in this home care program to match that, we are going to continue to have families in crisis. And it's really unnecessary. These are children who can go to school. These are children who can learn. These are children who can be social. These are children and families who need to work to contribute to our community. And so, I mean, there is not a single way that I see any detraction from what we're asking for here, because nurses making more money contribute to the tax base, contribute to our economy. Parents who get consistent nursing get to have jobs and get to contribute and pay our mortgages, and our children get to learn to be happy. And that's all we're asking for, is to put back the puzzle piece that the state has removed and artificially created a problem that didn't exist.
We are begging the governor, pleading the governor to please stand up for Rachel, Ella, all the other families here, the seniors in our community, all those recipients of home health. Please don't leave us behind. We are desperately needing you to stand up for us.
I don't think there could be a better advocate. You did an amazing job.
You're an amazing girl.
Lastly, here today, I'd like to offer the perspective of the non-medical home care providers. And we have Ann Wilson, Client Services Manager at Companions and Homemakers.
Thank you, Tracy. I'm Ann Wilson, Client Services Manager for Companions and Homemakers. And first, I want to thank everybody for being here today, and what an honor it is to be here with colleagues and families and representatives from the state on this issue that is so critically important. I'm here today, as Tracy mentioned, to speak on the non-medical side of services. My company provides services predominantly for the elder care population. I speak today on behalf of the non-medical agencies that belong to the Home Care Association of America, our Connecticut chapter. And when I say that it breaks our hearts to turn down the requests for services that will keep people in their homes, just because they rely on Medicaid assistance, but that's something that it's come to, sadly, and it's devastating. For years now, the state of Connecticut has refused to adequately fund Medicaid services. It's not even close, and now it's a crisis, a true crisis, as you've heard everyone in the state today. 1 month from today, on August 1st, when the minimum wage increases again, it will have risen by 28%. Rightfully so, that's an important aspect, but our increases have only kept pace at 5%, not nearly enough, and it hasn't kept pace. Regardless of how high the minimum wages increase, our caregivers believe, and rightfully so, that the work they do and they perform in homes deserves much more than a minimum wage, and we agree. Just last week, Companions and Homemakers, one of the largest agencies providing such home care services, regretfully notified the state that will not be able to take on new clients for the homemaker and companion level of services. And that's devastating after 31 years. We need to be able to continue to service the clients that are with us now and also be able to take on new clients in a critical care sector that need living care, that need personal care assistance, that require mobility support or memory care support. So we're having to make the difficult decision not to be able to help with some of the basic things that are so critical to keep people in their home as those entry points. This is incredibly painful for us and those in need of services. It's a self-destructive fiscal policy for the state, and we helped, as everybody mentioned, save the state over $500 million in 2019, and that's just a small fraction of the additional savings that I'm sure were incurred during this past pandemic year. This contributed significantly to the state's $2.3 billion surplus, but government chose not to reinvest in these essential care services, the home and community-based services, after saving all that money. I don't understand it. It just does not add up. By refusing to reinvest in home care, the state is consigning too many Medicaid recipients to institutional care who don't belong there. Finally, I've been asked to speak on behalf of Brenda Marks, whose mother is a client of ours and who has been able to remain in her home for 10 years with companion and homemaker support. Brenda is able to go back to work and comfortable doing so, knowing that her mother gets the critical care that she needs in order to be able to remain at home. And she talks always, every day, about how good her caregivers make her feel, how important they are in their lives, and how loved that they feel. You know, I don't think that somebody can get that continuum of care on that emotional level in a setting when they're forced to be removed from their home, and that's just devastating. Today, if someone like Brenda came to us on behalf of her mother, you may have to refuse that care. You may have to refuse that service. And that's just heartbreaking, and more importantly, it's absolutely unacceptable that we're not getting the support we need here in the state to be able to provide these critical care services. You know, a society can be judged on how it prioritizes, cares for, and rewards elder and vulnerable population. And sadly, I have to say, Connecticut is failing that. We can do better, and we need to start here today. Thank you.
Thank you, Ann, and to all the other providers and families today for your support. In closing, we urge our state agencies and legislators to dedicate adequate federal funding to home and community-based agency providers now. Use the American Rescue Plan dollars and help us. Our recommendations are clearly outlined in the document that we submitted to the Governor's Office, OPM, and DSS earlier this week. Lack of funding support will result in our providers no longer being able to provide much-needed Medicaid services in the community, which ultimately costs the state far more money through institutional care. Thank you. Happy to take any questions anybody might have.
So what's the response that you got from Benny?
Thank you. The question is, what's the response that we've received on the letter, correct?
Yes.
Yeah. The letter was submitted on Tuesday, June 29th, and to date, July 1st, we have not received any response.
Are you expecting to receive a response?
An immediate response, probably no, but I would expect to have some response, hopefully by next week.
Thank you. The governor, I believe yesterday or the day before, was proud to announce his initiatives that support women and girls. As we know, women are predominantly the caregivers. As my sister and I look after my 95-year-old father, not only by not supporting the home health care agencies and everyone gathered here, we are hurting them, we are hurting their children, their loved ones, but we're not enabling those caregivers to do, as we heard, go back to work, contribute to the state's economy, have real jobs. This seems to me like a no-brainer. Everybody wins if we provide this funding. People get to stay at home. They have quality lives. We support the very treasured people who care for them, and we allow the people to whom they belong, who treasure them as well, to go out and get jobs and have mortgages and raise revenue. So really, this makes a lot of sense to me. Thank you.
So what about, while you're there, Representative, I believe there's what, 450 to 500 million left in American Rescue Plan funding that remains to be allocated. There's going to be, I guess, a special session at
Yes.
some point in September. Is this something that might be addressed at that point?
I hope so, but that's a one-time fix. We certainly need to find the money now, but given the fact that there's been that 15% cut, even bringing them back to where they were before, we're constantly told, prioritize, stop picking winners and losers. Well, these people should be among the winners category.
Wanted to clarify also the question about the American Rescue Plan dollars. Yes, there's $450 million available to be divvied up amongst a variety of services, but there is a specific 10% federal match, FMAP, that is available for home and community-based services only, and that is something that we are truly focused on right now, and that's what's included in the letter that we submitted to OPM and Department of Social Services this week. And we would hope that that would be dollars that would be much more immediate than waiting for a special session down the road. Anybody else? Okay, I'd like to thank everybody for coming today. For the media and all of our providers. We truly are passionate about this issue, and we do hope that the state will find a way to fund us. Thank you.